Kampala, covers all the central parts of Kampala and all the parts of Uganda. We are also live and clear on Voice of Butebo in western Uganda and all the other parts of the country in the western south of Uganda. Ampaire Amon Otega is my name, and I welcome you to this edition of UBC Ground Zero, and we're going to be talking about something that is very important to all of us, especially when it comes to our health and our lives. And we're going to be talking about dealing with the challenge of non-communicable diseases in Uganda. Forget about the other Ground Zero that is full of politics and politicians. This time we have a very big privilege and honor to have a very special team of guests that are all scientists in the house, and the language that we're going to be using this time, it's going to be a bit scientific, so don't be lost, but rather come so close to your radio set and be able to learn and also to be informed. I do have a privilege and honor to have Dr. Komakech Dennis is coming from NCD department from the Ministry of Health. Welcome to this edition of UBC Ground Zero, Dr. Komakech.
Thank you, moderator.
We also have a big privilege and honor to have Christopher Kwizera, who is the Executive Director coming from Uganda Non-Communicable Diseases Alliance, joining us this morning. Welcome, sir, on this edition.
Thank you so much, Emon, and I do want to thank the listeners this morning.
A privilege and honor having heard from the gentleman. We also have the neutralizer, who happens to be Cheryl Kansabe, is the research and learning officer, is the nutritionist coming from the Department of Nutritional Science, and she's going to say, all right, as coming from Chambogo University. Welcome to this edition, Cheryl.
Thank you so much, Amon.
What is that word I wasn't able to pronounce well?
Actually, there are two.
Okay.
First is my name. It's Shali.
Shali. Apologies.
Then dietetics. Yes.
All right. Thank you. I've already started learning from this edition. Welcome, Kansabe.
Thank you.
Our dear listener, we are going to be live on YouTube. In case you want to go away from your radio set, we are live on UBC channel, that is UBC Radio on YouTube. Just enter UBC Ground Zero or UBC Radio and you'll be part of the conversation. But in case you want to contribute or ask anything from my guests that you've just had in the studios, don't hesitate to call on 776-511-426. That is the number to call, and we are going to be able to pick your concern, pick your question, and also you can as well send your messages on 0701 24 26 47, and we are going to be able to read all your messages to make sure we all move together as the people of Uganda. We bring you all these experts to make sure that we stay informed, stay educated, in that we avoid any other challenges that may come our way, especially when it comes to our health. Dealing with the challenge of non-communicable diseases in Uganda is going to be our concern, and also our discussion or subject of a discussion. There is a report that was released by New Vision of recent past, and they said that diabetes has increased, and it is a silent killer, and most people have fallen vulnerable to this very disease. And the researchers say it has been attributed so much to our feeding, but to our lifestyle, and we bring you these experts in the studios of UBC to help us understand what is this about. I will start with you, Dr. Komakech, and to enlighten us about this very one topic in today's discussion, which would include the conditions of diabetes, cardiovascular diseases. I don't know where the cancer also may come in. We have been talking about chronic respiratory diseases, which pose a really significant health challenge globally, but also here in Uganda. If you're to see in Uganda, we have distinguished the panel of experts that are joining us this morning to make sure that we learn. Dr. Komakech, the microphone is yours.
Thank you, moderator. Good morning, listeners. I want to take this opportunity to thank the UBC team and my bosses from Ministry of Health for giving me this opportunity to share on this topic of NCDs. Yes, NCDs, surely it is a challenge, a big challenge, not even only to Uganda, but globally. From the statistics we have, 1 million people die each year from these NCDs. Now, coming back to Uganda, NCDs accounts for 33% of all the deaths that happen in Uganda. Which means for every 3 deaths, 1 is due to NCDs. Now, NCDs are several in types. You already mentioned the cardiovascular, which accounts for most of these deaths. And under cardiovascular, we have the heart attacks, the hypertension, the stroke. The list is long, and it is the leading cause of this death. Apart from cardiovascular, we have the chronic respiratory diseases, where we have the COPD, which is chronic obstructive pulmonary disease. We have the asthma. We have diabetes. We have kidney diseases. The list is long, not forgetting the accidents and injuries. Now, there are risk factors that are associated with these NCDs. And basically, these are lifestyle risk factors. For instance, tobacco smoking, physical inactivity, harmful use of alcohol. We are not saying alcohol is bad, but harmful, consuming in excess, unhealthy diets, air pollution. These are the risks factors of non-communicable diseases. And these risk factors are what we call modifiable. We can manage them. We can manage them, we can prevent them, we can control them, such that we can control these non-communicable diseases. The moderator talked about the increase in the numbers of diabetes in the country. It is true. Diabetes, currently we stand at 3.3%. And 3.3%, it is a big number. It is over 1 million. Because if 3.3% of the total population from the recent UBOS statistics, we are standing at over, over 40 something million? 46?
45.
45 million. 45 million, 3.3% of 45 million. These are big numbers. And these all stem from this lifestyle, the unhealthy diets. People are eating too much of sweetened beverages. They are putting too much sugar in their tea. They are taking the sodas. They are not doing physical activity. These sugars, these foods they take in, they are not burnt. They are not used. So this ends up accumulating and causing this diabetes. Then not forgetting the other factors that cause diabetes that are out of our control, the genetical factors. These for instance, the type 2 diabetes, the type 1 diabetes. The type 1 diabetes is more of genetical. People are born with it. It could be because of the pancreas cells that produce insulin are destroyed. So these are normally children who come up with diabetes right from birth, which we cannot control. But majority of this diabetes, of the 3.3%, are from our lifestyle, which we need to work on it. Thank you. Over to you, moderator.
Most welcome, Dr. Komakech from the Ministry of Health. Now allow me bring in to you from Uganda, NCDC Alliance, and also looking into the numbers that Dr. Komakech has given to us, and also from your field of expertise. Are we really safe? Where is Uganda going? And what have you come out as the alliance to make sure that you save the lives of the people of Uganda? I know you're so much into the advocacy and awareness, and what role does really the alliance play in raising that awareness about NCDs among the public and the policymakers in Uganda? But how far have you really identified the situation? Is it worsening on your side? Because Dr. Komakech says that this is a very big number, that we are losing 3.3% over 1 million people. I don't know what is on your side as an organization.
Thank you so much, Emon. And like you introduced me, my name is Christopher. I work with Uganda Non-Communicable Disease Alliance, and at the NCD Alliance, our major role is to amplify the voices of the people to ensure they access services on prevention and control of non-communicable diseases. And like I said, we are an alliance, and we are made up of a number of organizations that include Uganda Diabetes Association, Uganda Cancer Society, Stroke Foundation Uganda, and many others. The Uganda Heart Health Alliance, and all other organizations that of course fight NCDs, including those for sickle cell, epilepsy, mental health illnesses, quite a number. Now, as an alliance, we also have other partners. We are members of the East African NCD Alliance. We are members of the Africa NCD Alliance. We are also members of the Global NCD Alliance. And we amplify voices of the people at various levels through those partners that I've mentioned at the East African Community, at the African Union, and of course at the UN through the WHO. NCDs we are talking about, they include majorly the cardiovascular diseases. Those are heart-related diseases and are diseases of the blood vessels, especially the high blood pressure or hypertension. And then also we are talking about heart failure, we're talking about strokes, but also talking about cancers. Cancers are very many of the type, but specifically we look at the commonest ones, which include the cancer of the cervix, and then breast cancers, then cancer of the prostate among men, then skin cancers, and other very many cancers that we talk about. The cancers of the liver, cancers of the throat, cancers of the lungs, very many. And then of course we're also talking about chronic respiratory diseases, and notably we look at asthma and others. And then I talked about sickle cell and then others, but we also categorize them as especially those that are diseases related to lifestyle or lifestyle diseases. Those are ones that probably do not have direct causes, but we develop them because of our ways of life or our lifestyle, or the way we manage our lives and the way we do our things, the things that we do. And of course, the lifestyle diseases I'm talking about is, we start with cancers, diabetes, high blood pressure or heart diseases, then chronic respiratory diseases. The lifestyle that I'm talking about that predisposes us to these NCDs include excessive smoking, smoking per se, and use of tobacco in all forms. Whether you chew it, whether you sniff it, whether you drink it, whatever you do with tobacco, it's a risk, and one of the major risk factors to non-communicable diseases that I've mentioned. Then the other one is excessive consumption of alcohol or harmful use of alcohol. Alcohol is also another major risk factor to the non-communicable diseases. And then of course the other risk factor is physical inactivity. If you don't do exercise, WHO recommends at least 30 minutes of moderate to physical exercise, 30 minutes every day for 5 days, or probably 150 minutes in a week. And of course, we're also talking about unhealthy diet. I know Shari will be talking about foods, but unhealthy diet, we're talking about those are refined foods, then trans fats or fats. We're also talking about high carbohydrates, but also talking about failure to take enough vegetables and fruits in your diet. So we would recommend that people eat adequate vegetables compared to other foods that you would be wanting to eat. So all those predispose us to the non-communicable diseases. Of course, Dennis, Dr. Kumakecha talked about the figures, and sometimes I want to desist as an advocate. I want to desist from talking about those statistics, because statistics, we have numbers. those statistics you talk about, they are numbers and people want to look at them as numbers, but we are talking about people. Every time you hear 30%,
but those numbers help us to get the picture of those that are.
I just want somebody who is listening to us to not look at them as numbers, just know that these are people. These are people we are talking about, and people are dying. So about 36% of all deaths in our country are due to non-communicable diseases that I've just mentioned up there. And when we add injuries, those are road crashes and other injuries, accidents, we go to around 46. So 46, now that means a half of the people, because if you start talking about 446%, that means for every 100 people who die in this country, 50 of them have died because of non-communicable diseases. Well, if we include the injuries, those are road crashes. And therefore, it's a big problem, and the problem can only increase if we do not intervene. We are quoting the data from WHO, but we should also be able to be mindful about our local data here. If you talk about high blood pressure, we are talking about 25% of all adult Ugandans, 1 in 4. If you're seated where you're seated and you're listening to me and you're 4, count from either direction. You know that one of you has high blood pressure or has raised blood pressure. And now that would not be a big problem, but the biggest problem is that 80% of the people with high blood pressure, they do not know. They keep walking with their blood pressure high. Before they know it, they fall and die. And these are the people whom you hear that somebody they found him dead, was driving, was behind the wheel. He was in his garden, he dropped dead, and you do not know why. And the problem is, he gets a stroke, he gets a heart attack, and he dies immediately, and you can't know. Then people start saying he was bewitched or something else. But that's the problem that we have. Now, when it comes to the cancers, when you get reports from the Uganda Cancer Institute, government institution that is mandated to manage cancers in the country, both treatment and prevention and control, they will tell you that close to 90% of the patients whom they get die within the first year of diagnosis. That means that they come when it is late, stage 4 and stage 4, and I mean stage 3 and 4, and therefore the health facility cannot do much. Within 1 year they will die. And those ones that remain also, it's basically on palliative care, not necessarily that they are going to be treated and they cure. Now, so that's now another worry. Now, Uganda, I'm just trying to amplify the numbers that Dr. Kumakech brought forward. Then the other to have is on diabetes. For diabetes, you realize that up to for every one person diagnosed with diabetes, there are 2 others who do not know. So in other words, it's similar to high blood pressure. So you're looking at close to 70% of the people with diabetes are undiagnosed and they are walking. So when you look at all of that, we know the government of Uganda, and we want to appreciate the government of Uganda for putting in a lot of efforts to make sure that they control these diseases and they provide the treatment and management. But again, the challenge is for diabetes, you're only looking at 30%, because they're the ones who are in the hospital who are looking for medication. For high blood pressure, probably you're only taking care of the 20%. And the cancers, you're only going to treat 10%, but you're also going to have the 90% of your patients whom are putting in a lot of money who are going to die in 1 year. So what are we going to do in this case? For us at the Uganda NCD Alliance, we are actually saying that we haven't done enough as a government and as a people, so we have to do more. The only thing we needed to do is probably to go out and encourage.
Are there recommendations that perhaps you have put to government, especially to public and policymakers in Uganda, that you wish, if they are implemented, then we're going to be moving on a better page as the people of Uganda?
Numerous and several. And that's the reason. One of them is why we are here. Create awareness for these non-communicable diseases. And one of the things people should actually know is that the non-communicable diseases that we have mentioned, the biggest problem with them, they do not show signs at the onset, or you may not feel pain at the onset. You live with the disease until it is grown and it gets complicated with, and then by the time you want to seek care, actually it has complicated and nothing much can be done. So we want to create awareness and encourage people to access health facilities and get screened or get checked regularly and routinely, that every time somebody gets in a contact with health facility, make sure your blood pressure is measured, your blood sugar is checked. Probably if it is a screenable cancer, you can be screened for that cancer, and if you're eligible at that level, at that stage. And so what are we telling government? We're telling government that, number one, make sure that every health facility has adequate resources and adequate screening services for those NCDs. Make sure that every health facility has information, has adequate resources to provide information for these diseases. Make sure that the facilities that are supposed to be providing care and treatment have enough facilities. Make sure that they treat the people that need the services. If it is a referral system, if it is a referral facility or referral center, it should be well equipped to ensure that the services are actually provided. Now, where must get these services in the private setting, they must get them at a subsidized cost, because once you've been diagnosed of cancer, once you've been diagnosed of high blood pressure, once you've been diagnosed of diabetes, especially diabetes and the other heart diseases, you may live with these conditions for life, and therefore you will keep going to the hospital every day, every month, or maybe routinely, as you may be directed by the clinicians or the doctors or whoever is providing care to you. And therefore, if you have to be paying, if you must pay for the services, then you are going to be paying routinely, and therefore the services must be subsidized, or else you get impoverished, or you fail to access the services simply because the monies that you have run down. And the worst of that every day of your life, once you are diagnosed, your productivity, your level to perform goes lower and lower, and therefore some people have also lost the jobs because of that, or they cannot produce as much as they are producing, and economically they keep running down, yet the costs that they must meet to keep their health better keeps going high. So we are asking government to either subsidize or make sure that these services are freely available to the people who need them. So
interesting. Thank you so very much, Dr. Kwizera, on that. Allow me bring in, since all of you have been pointing to our lifestyle and our nutrition and how perhaps we treat ourselves, we become vulnerable to these NCDs. And allow me bring in now the researcher from the research institution, that is Chambogo University, Kansavi. Looking at the diet and prevention, what dietary factors that contribute most significantly to the prevalence of these we call NCDs, especially in Uganda?
Thank you so much, Amon, and my fellow panelists and the listeners today. Looking at nutrition as one of the contributing factors to the NCD prevalence, I would like to point out the fact that it has roles to play along very many the food value chain, and we can be exposed to NCD risk factors along the different nodes of the food value chain. So I'll begin by talking about the food, where we get the food that we eat. We have gardens where we plant our foods, which for one reason or another at some point may not be in a good state. We have issues to do with the use of pesticides as we are planting our foods, but also as we rear animals that we shall eat. And so some of the foods are picked from the garden with what we call pesticide residues. And the science tells us that an excess of consumption of pesticide residues actually increases our risks for some of these non-communicable diseases. And so we need to keep an eye on that particular area, but also on the quality of our soils. Where we're planting our foods, there's a lot of land pollution with plastics and other pollutants that definitely end up in plants, but also in animals, which we evidently consume. And so we get harmful chemicals into our bodies, into our blood cells, and eventually resulting in diseases. The other node along the food value chain where we could be exposed to NCD risks is at the point of harvesting and post-harvest handling of the foods. I'll give an example of a time I was in Kabarole and doing community work where we met farmers that told us that they actually harvest fresh beans from the garden, and because of climate change and the unpredictable rains and the lack of enough sunlight, they heap them in their houses, cover them with tarpaulin, after spraying them with some pesticides. And what these pesticides do is that they quicken the process of drying of the beans, but in addition, they bulge the beans. So the beans become big, they look nice, they fetch more income. We've already noted that before you harvest a plant or before you milk a cow, after you've given it antibiotics, after you've given it some pesticides, you need to allow some time to pass before you harvest that food, before you milk that cow. But in addition to having harvested these beans before the allowed time passes, you are spraying again in the barn, and you are increasing the concentration of these pesticides. And unfortunately, the communities, including myself, we don't know about this. We find beans looking very nice somewhere in a casserole, and we're happy to buy. But that one puts our lives at a very big risk for non-communicable diseases. We have you've heard a lot about aflatoxin arising from the growth of molds on foods that have been kept for long, but also that have not received enough drying. So aflatoxin is something that we are really looking at. Civil society is up in arms against aflatoxin, as well as researchers in different universities in the country, to ensure that we are able to fight aflatoxin. Aflatoxin is a cancer-causing agent that comes into our bodies after we've eaten food that has not dried well, that has grown molds. Most of the time, even after you've dusted off the mold, the aflatoxin will still be inside the food item. The other area along the food value chain is at the point of food preparation and at the point of serving food. We are using all kinds of materials to prepare our food. We have saucepans these days that grow some weird materials inside them. When you leave water in a saucepan for even just a few hours, you find that it has grown something. We have people cooking food in kavera, covering food in kavera, serving food in kavera. We have those of us that like matoke being cooked in sacks. It's very absurd, very absurd indeed, that there's a study that's recently been published by the Royal Society, by the Royal Academy of Sciences, about what they call microplastics. And what that means is that particles of plastics getting into our food, getting into our bodies, getting into our blood. And the risks of that is they have mostly been related or associated with an increased risk of cardiovascular diseases. By cardiovascular diseases, we mean diseases of the heart and diseases of the blood. So like Dr. Komakit said, things like high blood pressure, things like strokes, things like coronary heart diseases and the like. So we need a lot of education as well as interventions, many types of interventions around how we are preparing and serving our food. We have another node, food processing. There's a lot of nutrients that we lose when we process food in the different industries where it is processed. And in so doing, we mostly remain with a part of the food that just gives us energy. Because food gives us many things, one of which is energy. So we mostly consume food that has more energy than it should have, but also it has lost the important nutrients that are supposed to keep our bodies and guard them against diseases, including non-communicable diseases. So we eat a lot of that food, and there's an excess of energy in our bodies that actually just gets converted into fat. And so fat accumulation in the different areas of our body, especially around the abdomen, has been associated with a very high risk of all non-communicable diseases, actually. So we need to look into how we are processing our food and how we prevent the accumulation of dangerous chemicals even during the processing. There's what we call ultra processing. So there's levels of processing, but there is a level of processing which is very, very dangerous, where in addition to removing the nutrients that we need and just remaining with mostly energy, we also introduce new compounds and new chemicals in the food,
which are dangerous.
Which are very dangerous. So we need to carefully consider the foods that we eat. And maybe lastly, consumption. How much are we consuming? We need to consider that and make sure that our consumption is balanced. We're not only eating energy-giving foods, but we're also eating foods that have nutrients and vitamins that help the body fight against diseases, but also to balance our consumption. We don't in nutrition, too much of everything is bad. So we need to make sure that we balance up and our lives are healthy. I think I'll give the microphone back to you, Emon.
Interesting. Learn today in this edition of UBC Ground Zero, dear listener, I believe that you have a pen and a paper writing over these concerns and noting them down for the future reference, in that we live a very better life as the people of Uganda. We can only be able to enjoy the future and enjoy the country and all that we are doing today if we take care of our health today. I will get you on what needs to be done, Kansabe, on how we as the people of Uganda listening to this program and many others that we can educate, how best can we modify our diets to reduce these risks that you had started on it, but I would love you to extend and expound on it, in that we can keep this deep in our hearts and back on our minds to be able to prevent. Dr. Kumakech, you're into treatment, you're into health, but are there some solutions and challenges? What are the big challenges that Uganda faces in combating these NCDs? How many years have been onto this campaign, but it seems that the steps that we are taking based on the challenge that is in front of us, it seems to be bigger than the steps that we are taking. Are there challenges? And if they're there, what are some of the strategies? What are some of the programs that has the Ministry of Education, Ministry of Health and the government of Uganda implemented to overcome these challenges? Dr. Kumakech.
Thank you, moderator. Yes. The challenges in the fight against these NCDs are big, and there are many. First of all, what we are dealing with is overwhelming. because of the high NCD burden. By burden, we are talking of mortality and morbidity. Because when you look at every one in 4 of Ugandans have hypertension, 3.3 have diabetes, and looking at the mortality, that over 34% of the Ugandans of the deaths in Ugandans are due to NCDs. That is 1 in 3 of this death. Then there are several people with the disease in the hospital suffering, and this burden is overwhelming. But the government is not also sleeping. Government is working day and night to ensure that they alleviate the Ugandans from this burden of NCDs. That is through Ministry of Health and through Non-Communicable Disease Department. There are several projects or programs that I will mention later, but let me first focus on more of these challenges. Challenge number 2 is about the modifiable risk factors. Some of these modifiable risk factors have become culture of Ugandans. For instance, in the West Nile region, tobacco smoking is almost a culture. And eating the chikomandos, the roasted chicken in the roadsides of Kampala, of the cities of Uganda, has become a culture. So modifiable risk factors, these risk factors have become a challenge to us. That's why we need more of awareness creation in this area. Then this comes in with the limited awareness among the Ugandans. It is also a very big challenge that the Ugandans are not aware of the NCDs. They wake up when they are dead. They wake up when they are limping. They wake up when the sugars are high. And they are talking of witchcraft. They are talking of a lot of superstitions which are not true. We are telling you as government that these are caused by your lifestyle. The too much alcohol you're taking, the physical inactivity, the tobacco you're smoking, and the unhealthy diets you're eating, which with too much sugars, with too much fats, are the one causing this. Then we have limitation in our health system in terms of resources. The resources are limited. We are using it optimally, and the NCD department being also a new department, we are trying to coordinate all the NCD's partners. So you find that we have fragmented efforts everywhere, and this becomes a challenge. Now, Ministry of Health through NCD department, actually yesterday we were launching a project which is called DCAD, that is called Diabetes Compact. This is a pilot, a project that is going to deal in the management of diabetes and hypertension. And Uganda happens to be one of the lucky countries that World Diabetes Federation chose in Africa. Actually, in Africa, we have Uganda and Ghana. So they are injecting in funds such that they can support in the management, in the awareness creation of NCDs, most specifically diabetes and hypertension. We've moved all over the countries. We've picked the pilot districts. We were in Koboko, we were in Kabale, we were in Zimbabwe, and the project is launched and is on. These are some of the new projects that are going to help fight these diseases. Now, there are several projects. We have projects such as Pen Plus projects, which is being supported by still WHO through UNCD. Then we have Pen Plus project sites. For instance, we have one in Nakaseke, we have one in Atuturu. Atuturu is in which district?
That's Kumi.
Kumi district. These are pilot sites. We've already piloted the management of these NCDs, and we are at the stage of rolling it out in most of these districts. Actually, in the recent meeting we had chosen over 20 districts for us to roll out in general hospital. So at these projects that are coming on board, we are trying also to fight back against these NCDs such that we can manage it. But the best method of fighting these NCDs are the Ugandan themselves, because the management, the controlling of these risk factors are in their hands. They are not in the hands of government. So that's why we are coming here as government through this same forum to talk about how do we address these risk factors. I believe sitting in this UBC radio, I can tell people how dangerous tobacco is. Tobacco is dangerous at all levels, at all quantities. It is a carcinogen. It causes lung cancer. It causes cancers of the different parts of our bodies. Physical inactivity makes us obese, makes us get diabetes, makes us get heart attack, because these fats go and deposit in the blood vessels of our lung. Not forgetting stroke. These blood vessels are blocked by these fats because we don't burn them. And what is next? We get is ischemic stroke. The next time someone is dead. These same fats go and deposit in our blood vessels, causing what they call hypertension. And currently, as I speak, I want to tell Ugandans that a quarter of the population, from the STEPS survey that we did, have hypertension, had raised BP. And these figures are alarming. Through the same fora, we can talk about harmful use of alcohol. We are not saying alcohol is very bad. We are saying drink responsibly. Drink just enough. When you drink too much of it, alcohol causes even liver cancer. It causes liver cirrhosis. But people do not want to talk about alcohol. But we as government, we are here to tell you that alcohol in large quantities, in excess quantities, is bad. Unhealthy diet is also bad. We are taking too much of the sugars, and these sugars are not burnt. They are stored in the body. They are stored, they are converted into glycogen, into fats. We are taking too much fatty diet. The roasted chicken on the roadside. The recently I was moving in Gulu, I found a lot of pork being roasted on the roadside. They're having what they call trans fats. These are not good fats. Actually, some countries have banned these fats. They have banned these trans fats because they go directly to the blood vessels of the heart and deposit it there and block it. They go directly to the blood vessels of the brain and block these blood vessels. So as government, I believe that awareness creation through this fora of UBC, TVs, radios is the most important. That's why I'm here actually on behalf of government, such that we create awareness in these areas. Maybe if you could give me time, we could go through the statistics of the NCD risk factor survey so that Ugandans know where they are. We shall talk about it maybe when you give me time. Thank you. Over to you, Chair.
Interesting. Thank you, our dear listener, for being part of us from the time we started. We are live on UBC radio, UBC Butebo in Eastern Uganda. We are live on Butebo radio, Magic 100 FM, Western Nile radio in Arua, Voice of Bundabujo, and of course UBC radio in Kampala. And we're also streaming live on YouTube. Just enter UBC radio and you'll be part of the conversation. And you can as well use your phone to send us a message or call us on 776-511-426 and tell us what you think, what needs to be done to make sure that we get out of the line of this silent killer, diabetes and cancer, and so many others that the specialists or these experts in the studios are sharing. Before I take a break, I would love also to bring you on board Quizera about the alliance collaborating with government and other stakeholders to advocate for policies and non-prioritize NCD prevention but also on control. But most importantly, I would also want, if you have successful stories, to share with us the impactful initiatives that have been led by the alliance in reducing the burden of NCDs in this country. Before I take a break.
So much, on initiatives that we've actually had quite many. Just like you said, we do not work in isolation. We work closely with the Ministry of Health. And one of the things together, we've actually initiated a number of issues. We've put a lot of policies in place that actually support. Currently, we've embarked on mobilizing people living with NCDs in 2 groups. And as I speak, in most of the health facilities that have NCD clinics, people living with NCDs have come together. They support each other. Some of them have also gone a step ahead to contribute some funds that complement on the medicines, procurement of their own medicines, especially when they have run out of stock and the government cycle, time for supply has not yet reached. So they do that, but also they educate themselves, but also create awareness in the communities, and to us that is a success. And of course, the other one has also been a number of initiatives have been made. We want to thank the Ministry of Health that has passed a directive that all all health facilities should have NCD clinics, but they should also encourage formation of patient-led groups at the facilities. Then the other initiative that I've also had is a directive by the Ministry of Public Service that all workplaces, especially within government, those MDS, should always have at least 2 hours of physical exercises every week. Each workplace should set aside. That is in line with fighting non-communicable diseases. But also know that there are quite a number of things that government has put in place, especially the law on tobacco, the Tobacco Control Act of 2015 and the tobacco regulations of 2019 that are actually enforcing the act. We think the government is doing much, but we're also behind together with our other partners to ensure that these laws are in place and a number of policies. So basically that's what we've done, but I've also created awareness in a number of places. And of course, as an organization, we have also done a lot of campaigns for screening, also creating awareness. Like in Western Uganda, we've been able to work in the greater Ankole sub-region to ensure that we screen about more than 50,000 people on NCDs, and about 20% of them have been found positive and have been taken directed to for care. We have also reached more than 5 million. The entire coverage of UBC West we have been using UBC West to ensure that we reach out to so many people and creating awareness, and probably the entire coverage of that radio has been made aware of the NCDs and where they should seek treatment from. So basically that's what we've done. But I've like you are also quoting the report that came out in New Vision. Some of that information and what it reported is actually from our side and provided by our member, the Uganda Diabetes Association. So we've done a lot to create awareness. But of course, there's a lot the level of consciousness on NCDs is slightly going high. We know that the Ministry of Health is doing much, but we are also at their back. We'll keep telling them and keep reminding them. So the level of consciousness of the public, but also the actions of the Ministry of Health, some of them is as a result of our work. Some of them we don't want to talk about it, but also know that they may also not accept that we're actually pushing them to do certain things, because of course they are government anyway, but they must do and deliver their mandate. But we are with them, and we know a lot is working. And recently there is an alcoholic drinks control bill that is in place, and our member, the Uganda Alcohol Policy Alliance, is at it riding everybody. And of course it's a private member's bill that is before Parliament. We are riding everybody, and we're also asking everyone to support that bill so that we can control alcohol. Alcohol is a big problem in this country. Forget about it being a risk factor to some cancers and some NCDs, like we mentioned them, but it's one of the biggest problems, especially in road crashes. It has destroyed families, and families. Domestic violence is also another problem that we are facing because of alcohol, and therefore we hope everybody, every member of Parliament should come out supporting this bill and make sure it is passed into law so that we can have our country sober. Our country currently is not very sober because we are the leading alcohol consumers, I think, in Africa, and even in the world. We have a position or a place, not in the lowest, but among the highest consumers of alcohol, and therefore we must fight that.
I can imagine that we are leading in that. Anyway, we have a lot really to do to make sure that we change that position and become better citizens, and we be better in other sects. Before I take a very short break, I would love also to bring in you, Kansabe. Now that you come from a research institution, talking about research and innovation, are there any recent advancements or looking at research findings in regard to nutrition and NCD prevention that you as a person find particularly promising or not worth that will may benefit in the near future?
Thank you so much, Emon, and dear listeners. Regarding new developments in research for nutrition and aligning to NCD prevention, we have some work that is ongoing that has to do with the development of the food-based dietary guidelines for Uganda. And
may not necessarily be from Chambogo University. You would share what Chambogo University perhaps is doing, but across the board in Uganda, East Africa, Africa, and the world at large, if there are any innovations or developments in technology or research that you think would help us in the near future, especially in the prevention and control of NCDs.
Honestly speaking, that's a lot. There is so much that is ongoing. But let me first talk about food and nutrition, and particularly for Uganda. There is ongoing work on the development of the dietary guidelines, food-based dietary guidelines for Uganda, and what that means is that the government and development partners are trying to provide guidance to Ugandans on what foods to eat, what quantities to eat, how to prepare food and those kinds of things. So when those are done with and they're informed by a lot of research, where we collect information about food, we collect information about the composition of the different foods that we have in Uganda, what are the different nutrients and the amounts in the different foods, and what would make what we call a serving, how much of this food should you be eating in a day, those kinds of things. So when those are done with, we shall be able to have a population that is guided about how to consume their foods. At the moment, we have some dietary guidelines that are not adapted to Uganda's context, but they can provide general, guidance. And what we are telling people is eat half of your plate should be vegetables, and then a quarter of it should be proteins, and the others should be carbohydrates and fruits on the side, those kinds of things. So when these guidelines are out, Ugandans will be able to know how much of each food to eat. There is work on what they call nutrient profiling in response to the processing of food that is ongoing. I told you that there are different levels of processing of food, and so you need to be aware of how much processing has happened to this food and what that means for your health. So there will be labels on foods. With time, there will be labels on foods showing how much of a danger to your health certain food is, and that will involve a lot of research in understanding how much processing was done to the food, and then doing some lab tests to know how much of each nutrient was lost and how much of new chemicals and new items have come in. Now, talking about the global research in NCDs, for me, there is a lot of information at the moment globally about NCD prevention and control, and how we should be handling these issues, especially at country level and by decision makers at that level. There is what they call the WHO best buys for preventing and controlling non-communicable diseases. They are like a benchmark for what should be done. Now, what other countries do is pick up that benchmark and run with it and try to see how it can be done in their particular countries. One of the best buys for preventing non-communicable diseases is around controlling and eliminating what we call trans fatty acids from the food systems. Dr. Komakech, I think, highlighted about trans fatty acids. During processing of food, some natural molecules in the food are transformed into a very harmful molecule that causes mostly diseases of the heart and the blood. So that new molecule, which is dangerous, is what we call the trans fatty acids. And there's ongoing work, and we are very grateful to the partners that are supporting that. And the work has been informed by research, and we are continuing to do a lot more in that area to inform the regulation of these trans fatty acids. So a lot more is being done, but that is what is, I think I can get off my fingertips at the moment.
Interesting. Our dear listener, this is UBC Ground Zero. We are live on 5 radio stations covering entire Uganda, and we're also streaming live on YouTube. Just put UBC Radio and you'll be part of the conversation. We are live on UBC Butebo in Eastern Uganda, UBC West Nile in Arua, UBC Magic in Kampala, UBC Radio in Kampala, and Voice of Butebo. Keep it UBC, and we're taking a very short break. We're coming back in just a bit. And when I return, I'll be reading the messages and also picking your calls on 776-511-426. I can see so very many messages coming in already. Bamwine, Jambo, Harriet, Samson, and many others. I can see your messages coming through. Please keep them brief and put your name and where you're listening in from. I'll be reading your messages to the guests in the studios to be able to answer all these concerns. And I'm coming back in just a bit. I pray you don't go away.
Season 2. Stay tuned. We shall be right back. It's hot.
We passed it. We didn't know exactly what the problem was on the ground. There is no pretending about the effect of this thing. There's no pretending about it. Nobody showed. It's a problem.
It's balanced.
This is not the stage at which you start planning to tax a commodity like coffee, especially from down there.
It's intellectually engaging.
The Constitution provides that the land must be registered under the customer tenure system, which is one of those that's recognized by the Constitution.
Ground Zero Season 2, live and syndicated on your public and national broadcaster, UBC, inspiring Uganda. We broadcast 24/7.
Baby, when the bright lights start to fade, fire up your lighter.
UBC Radio.
Where will we go? When the quarantine thing done and everybody touch road.
Listen to UBC radio shows right here, right now. UBC Radio.
UBC Radio, inspiring Uganda.
Every Saturday, UBC Radio broadcasts the Information Hub, your one-stop dial radio show. Join us to learn and know more information about innovations, research, and developments. The Information Hub, knowledge is power, on UBC Radio, inspiring Uganda. This is UBC Radio. Tune in for news.
At UBC Radio, we bring you Uganda's latest news and information.
Focus on Parliament.
What we need to do The Prime Minister must give us the position before we finalize with the budgeting process.
Enjoy sports, the environment, politics.
The mission we have is socio-economic transformation.
Health, entertainment, updates in education, on the farm. Keep tuned into UBC Radio, inspiring Uganda.
We passed it. We didn't know exactly what the problem was on the ground. There is no pretending about the effect of this thing. There's no pretending about it. Nobody should. It's a problem.
It's balanced.
This is not the stage at which you start planning to tax a commodity like coffee, especially from down there.
It's intellectually engaging.
The Constitution provides that the land must be registered under the customer tenure system, which is one of those that's recognized by the Constitution.
Ground Zero Season 2, live and syndicated on your public and national broadcaster, UBC, inspiring Uganda.
At UBC Radio, all our radio network across the country is committed to inform, entertain, educate, and guide for national transformation.
On radio, UBC should set its own example. Leka bano abatafa ku bantu baffe bagumaza ndowooza muganda kitwa kugumaza to divert people. Let our own UBC bring programs to educate the people so that abagala kugumaza babeereyo bagumaza naye naffe they can advise, guide. And people in time will judge the one who is their friend and who is just using them.
Tune into UBC Radios for credible socio-economic programs. UBC, inspiring Uganda.
Welcome back. Ground Zero Season 2 continues.
Welcome back from that very short break. Indeed, UBC Ground Zero continues on 5 radio stations covering entire Uganda. UBC Radio Nile Avenue Broadcast House in Kampala, and we also live and clear on Butebo Radio in Eastern Uganda, Magic 100 FM in Kampala, Western Nile Radio in Arua, and Voice of Bundbujo. We are also streaming live on YouTube, and the repeat of this program is always on Sunday from 3 p.m. to 5 p.m. on UBC Radio in Kampala, and also on Monday on Voice of Bundbujo. So you can create time and be part of the program once again. In case you missed part of the program, or you want to really go ahead and listen to it again. I do have a privilege and honor to have in the studios of UBC Christopher Kwizela is the Executive Director, Uganda Non-Communicable Diseases Alliance, and also we have Dr. Komakech Dennis is coming from Non-Communicable Diseases Department, Ministry of Health, and we also have a privilege and honor to have Shalil. I hope I got this very well this time. Kansabe is the Research and Learning Officer, Nutrition, Department of Nutrition Science, and Dix Chambogo University. Ampaire Amonoptega is my name, and we are discussing dealing with the challenge of non-communicable diseases in Uganda. Be part of the conversation by dialing 776 511 426. The number is 0775 0776 511 426, and is the number you can call and be part of the conversation. What do you think needs to be done to reduce the diabetes, cancer, and so many diseases that the experts have really explained to us? And in terms of policy and advocacy, in terms of many other policies, what do you think? Share your comment or perspective. UBC Radio.
Good morning, Papa Amon.
A very good morning to you.
Juma here at the best roundabout.
Most welcome, sir.
A greeting to all our panelists there today with you in the studio. Uganda health-wise, today they are better. And when pandemic came, COVID-19, I think Uganda was among the best countries who shown up that and then can be dealt with. We give credit to the health and together with their team. Nothing else much. Service delivery, accountability, We need transparency. And we need more researchers. The government can collaborate with the other big institutions, let me say, to the standard of World Health Organization. Together, Uganda can move on well. But you'll find some greedy few personnel who tend not to do their job. They are sleeping on their job. There are so many government properties at the back of the envelope or at the back of the boxes are indicated property of government, not for sale. We feel bad. Someone from Navy has been referred to come to Mulago National Referral Hospital. But when you reach here, you are brought here at Mulago. Mulago may also refer you to a place like Kumi, that you are suffering from a bone issue. And for us there in Nebi, we may think like Mulago is the mother of all the hospitals in the nation, this Uganda. Now, those processes, it costs much money to facilitate your movement from one hospital to another. Now, from the big one, you're referring me to the small one. Because when you're referring me to Kumi, yeah, it's also big at its capacity. But now, government, you bring for us staff. Add more staff. Cancers today, our agricultures, they advise us to eat organic food. Being an African, having a good dark skin, which is resistant to some of the heat. And we tend to ignore our organic food from the garden, the sweet potatoes and the Irish potatoes. We leave them to the poor one, and we go and look for the one in supermarket, which is already in a packet. You eat like as if you are eating biscuit, that you are eating a product of Irish potato, crispy, what they call crispy. So who is to sensitize the nation that some of these cancers we are getting, even, those things, some of them, they went through machines. How about today when you buy a new saucepan? From one day when you are using this very saucepan, just after finishing your cooking, then you are boiling water for drinking. After maybe in the morning, you are boiling in the evening. In the morning, when you are opening the saucepan to scoop some, 1 cup of water to drink, you'll find some funny stuff mirroring on top of the layer of that very saucepan, inside on the water actually. Then I become scared of taking that water. And yet our Ministry of Health is advising us to at least drink boiled water. But the saucepan we are using today, I don't know which chemicals they are using for manufacturing these saucepans. I don't know whether you have also witnessed or if not, you will do some research about it. It is not healthy. The water will look not healthy enough. That when we go to these other dressing codes, sometimes human beings start feeling coldness from the feet down, from the legs. We are not sure of what we are wearing today.
Right.
Also have to come and sensitize us about that.
Your final remarks, sir?
My final remark, appreciation goes back to the government, but we are crying for more facilitation for the medical staff and their motivation. They have to be motivated. They have to bring their share if it is needed, where necessary, where possible. And accountability is our key, because we don't want embezzlement of government drugs. And when we go to the drugs, they're the very one referring us to their own clinic. You go to which street, you reach there. Thank you very much, Amo.
Most welcome, Juma, for sharing those concerns to the people of Uganda, but also the guests in the studios. UBC Ground Zero.
Good morning.
A very good morning to you, sir.
Yeah, this is Martin from Muyenga.
Thank you so much, sir.
Yeah, I'm going to the doctor concerning about drinking and smoking. In fact, Uganda is the first smoking and drinking, because you find these foreigners of what they're appreciating about in Uganda, that Uganda is a free country. They can do what they want. First of all, drunkos. You find somebody which has taken alcohol too much, but is driving. Even they remove him from the chair to put in the car. He can sit and drive very well and put high speed until he reach. He can reach well over what, I don't know. Smoking. There's another cigarette. I don't know. They call it cigarette over what, which they put it in a pot or something look like a pot. Over they call it shisha. Shisha over what? How do you call that thing? Shisha over.
I think it is shisha.
Yeah.
It is shisha, I think.
Yeah. So that is thing. You find that a young girl over the woman over what also is smoking seriously. But the time of waking up, you fall down. So I'm asking that doctor that thing cannot also cause a cancer. Over it can damage also our lungs over what? So those are the things which were supposed to be to take care or to grow people.
All right. Thank you so much.
Manjuana is there, Jaga is there, that Shisha is there. Put Sportman, put Daniel, put Waraji, put what on one brain.
All right.
So that is what I want to say. I'm Martin from Mwenga. Otherwise, I'm greeting Juma. Thank you for your advice and be listening UBC all the time, Juma.
All right. Thank you, Martin. 776-511-426 is the number you can call and keep your messages coming through. If I can use this time to go through your messages, we'll start with Bonde in Arua, and you say tobacco control was highly given attention. Why not divert the same attention to alcohol, not only in consumption but also in advertising? Because what our young people see is what they take to be okay. And if you're to see most of the adverts that go through in mainstream media, they're advertising alcohol content. Where does this leave the fight for prevention of NCDs? That is Bond in Alua. Thank you. Samson in Muchuni says that I am taking a lot of honey both in bread and tea. Am I safe? Since one of them said that we are taking a lot of sugars, I need to be advised. Harriet is saying that my husband smokes a lot and I'm a victim of his passive smoke. Am I safe? All right. Someone also says, Bamwene is saying that our neighbor vaccinates his cows and immediately milks them for sale. Should we report him, and where should we report him? Because listening to the lady on nutrition, it seems that he has been killing so many people by his vaccinated cows and milking them for sale. I have learned this from this program, and thank you. All right. Ojambo says food in polythene paper is in polythenes and sacks is really dangerous, and if you're to go all the hotels and restaurants that sell food, most of them use these, and we have also blessed them in our home. You find that if you wanted to eat very good matoke, one would opt for the polythene. Are we not all victims of death? Someone says also food process loss. She says food process loss of nutrition. Do factories also consider this and put some nutrients that we have lost in their process, or whatever they lose it, they don't mind as long as they have packed and put on the market? Someone also says from what the experts have said in the studios and in this program, it shows that all of us are candidates of NCDs and death is on our door. How many people consume Chikomando and how many consume they call our favorite chicken? God have mercy. Keep your messages coming through. There are so very many coming through, but I promise that I will be reading a lot. And also let me read this one. How do I know that I have genetics? The doctor Kumakech taught us about genes, and my dad died of diabetes. Could I be the victim? Maybe I have these genes and I don't know. How do I find out? And lastly but not least is Cameroon. Oh, you're listening from Cameroon. I don't know. You say, what are the signs of diabetes in case I have it and I don't know? All right, keep your messages coming through or call us on 776-511-426 and tell us what you think or what needs to be done or any concern that you have for my experts in the studios to answer it. Let me also go back to the studios for my guests to answer those concerns, doctors and the lady. And I'll start with you, Komakech, and then Kwizela, and then I will end with you, Kansabe. Dr. Komakech.
Yes, thank you, moderator. The questions are many. I don't know whether you're dividing it among us or I can answer randomly.
You can answer randomly, maybe Kwizela, and I think there are some that were specifically to you and those that were specifically to Kansabe and also to Kwizela. So those that you find in your line, please, you can answer them.
Thank you. Thank you, listeners, for bringing out those brilliant questions. And let me start from the last one, question number 11, where one of the listeners talked of the dad having died of diabetes, and is he also most at risk? Now, what I can assure you, one of the strong risk factors of diabetes, hypertension, of some of these NCDs, including cancers, are the familial link. If you have any familial link, you need to try to, as much as possible, to avoid some of these risk factors, because actually there is what they call attributable risks due to the familial link. It's actually more than 20%, which means you need to avoid these risk factors, the modifiable risk factors that makes you get diabetes. You need to avoid them because you're most at risk. You're not like this person whose father did not have diabetes or whose mother did not have diabetes. So you need to be checking yourself regularly. Check your sugar levels. Check your physical inactivity. Do you do normally physical activity? Check the diet you eat. Check the amount of sugar you put in your tea. So you need to be on standby and very alert, because you're most at risk. Your risk is higher than any other person whose parent did not die from diabetes. Yes. Someone asked for the signs. This is the signs of diabetes. Signs of diabetes, they are very clear. This is what we call excessive thirst. Someone feels thirsty every time, unnecessary. The person is taking in water. This is accompanied by moving out to go and urinate every time. Some of them eat too much. Some of them have complications of the advanced stages of diabetes. But these are the early stages, the early signs and symptoms. Going so much every time, going to urinate, taking too much of water, feeling thirsty every time. These are early signs. Please run to the nearest health facility and do a random blood sugar test. And the test that we prefer here is the fasting blood sugar test. We encourage you to reach your nearest facility. Then someone talked of polythene. Polythene, truly, it is dangerous. Polythene has some chemicals that are carcinogenic. My colleague will talk more about it. It has a cancer-causing agent. I'm not campaigning the polythene industry. That's why I love so much other countries that have banned polythene. There is a chemical in polythene that causes cancer, and we are busy carrying our foods in these polythene bags and contaminating our food with this chemical, this carcinogen, and at the last moment, that's why we are having rising cases of cancer. Uganda Cancer Institute. It's because of the way we package our food, and yet we have several of the paper polythenes, which are actually harmless. They are better than the polythene bags. Then Susan talked about the husband being a smoker and her being a passive smoker. Actually, Susan listened to me very well. A study was conducted. This study discovered that the risk of getting lung cancer when you're passive smoker, it is more than 3 times a smoker himself. This is a study that was conducted. So you're most at risk than even the smoker. I'm not threatening you, I'm not scaring you, but these are facts on the ground. So you better.
So if the husband is smoking once, then for her she's smoking thrice, 3 times.
The risk is 3 times of her getting lung cancer. Yes, that is the risk. Actually, the risk of her getting lung cancer is more than the smoker himself.
Wow.
We buried my friend's mother. The husband was a smoker. The husband is still alive, but the mother has died with cancer of the lung.
Because she was a passive
smoker. Yes, the risk is more with the passive smoker. That's what studies show.
Should she run away when the husband starts smoking?
I think prevention is better than cure. You need.
She's not the only at home, meaning that all the others are also victims of the same.
Very true. This is very true. So I wanted to bring out that clearly, that a passive smoker is more at a risk of getting lung cancer than a smoker himself. That's what studies show. So that is a message to you. You need to run as far as possible. I thank Parliament and Ministry of Health with the backing of Uganda NCD Alliance, who were able to bring out the laws against smoking, and the laws are very clear. We lack on enforcement. The laws are very clear, the laws are very strong, and the laws are very good.
One who sent in a message from Arua that the attention that we have given to tobacco control, can't we use the same on alcohol consumption?
Very true, moderator, but I want to bring out this very clearly. The Department of Non-Communicable Disease has a division that is in charge of that. That is the mental health and substance abuse control. We've been fighting tooth and nail to make sure actually we have alcohol bill, but we are getting a lot of resistance from the industries. They are so powerful. They are so powerful. And almost everyone in Uganda, from our step survey, it is saying in every 3 Ugandan, one is a drunk, one takes alcohol. So now it is faced a stiff resistance from Parliament. Up to now, they are almost shelving our.
Maybe we can opt for some strategies to reduce on the consumption. Maybe consuming it at night and for hours. I have seen some countries that have opted for that, and they are well.
Exactly, that's what we are advocating for in what is contained in that bill. Okay. We have those hours.
Yeah. Minutes, sir.
Yes. Now, before I leave, I want to talk about shisha. Someone talked of shisha. Shisha has cigarettes. The shisha has tobacco. Shisha has cocaine. Shisha has those mixers, and it has high content of tobacco in it. And tobacco, we know it has what we call nicotine and tar.
All right.
And tar is the leading cause of cancer. So I want to say that shisha can cause cancer. Thank you. Over to you, moderator.
Ground Zero.
Yes.
You're live on radio.
Yeah. Yes, I am Onega David Francis.
You are calling us from where?
I'm from Wakiso.
All right.
But I'm a Lugwara by tribe.
All right.
From Arua.
Your concern, sir?
So my concern is about what you say that you can get cancer if somebody smokes and if the first smoker is at high risk. Now, but whatever you have trying to talk about this disease, the non-communicable disease. Now, if it is like that, is it not what is called what? This is yeah, I think that's wrong because this tuberculosis can be the one who can be shared through person smoking.
All right.
Am I wrong?
The experts would enlighten us about the same.
If a cancer is not communicable disease,
okay,
how can it be shared?
All right.
Yes, I'm Onega David Francis.
Thank you, Onega.
Mingoni.
Mengoni.
Amamuke.
All right. UBC Ground Zero, the people of Uganda sharing their concerns there. I will go back to you, our Quizera. Maybe I can as well pick this one. UBC Ground Zero.
Yes, good morning.
A very good morning to you. Your name and where you're calling us from?
Yes, speaking to Annette.
Annette from where?
Annette from Chireka.
All right.
So my concern it is, for me, when it reaches night in the night hours, I do take a lot of water and I urinate almost 10 times even. My stomach used to be too hot in the night hours. So what will be the cause, doctors? Thank you.
Most welcome, Annette. All right. Quizera, you've heard from the people of Uganda who are part of us from the other side of radio, but also to be specific, you had so there are so many concerns, but there are two specific, I think, addressed to you. Someone says, I want to ask the one from UNCDA on why they don't advocate for the ban of Kavera use in Uganda, yet we have a law on the same, but has not been implemented. And the same was taken to Rwanda the way it was, and it is well implemented there. As the advocate, as those that are working on advocacy, what have they done? And also someone says that why do those who are into advocacy collaborate and work with the UNBS to make sure that they visit those factories and industries to make sure that they produce what is of quality for the people of Uganda to consume. Let's start from there. You have 3 minutes, sir.
Thank you so much, Amon and the listeners, and thank you so much for sending in those questions. Well, start right off from advocating for banning of the Kavera. I know there's a lot of bills and a lot of laws that have been put in place to ban Kavera, but they keep being postponed. And the challenge you have is that I think I will just speak straightforward that the Minister of Industry and of course and their partners. There's a lot that has been done about Kavera, and there's a lot of bans have been put in place. They look at those, are they microbes or something like that? They want to do that, but there's a lot of work that has been done on the Kavera. So, and of course, I also want to take it back to the people that if you stop using the Kavera, then the manufacturers will not have the market to use it. So, it starts with us. I do not want to go and start up there, but I also have to speak to myself. That do I pick the Kavera? Do I buy it? If you don't buy it, if you don't use it, then of course the manufacturers have no market, and therefore it won't be in the market. Then of course the other one was like advocating for the, and somebody was talking about, I think, smoking, that the energy that is put on cigarette, I mean on burning, on tobacco, why it will be put also on alcohol. I think Dr. Dennis tried to explain that, but one thing we know that there is a law on there's a Tobacco Control Act of 2015, and currently for alcohol we have a bill. And that's why we are calling upon everybody to support this bill. Wherever you are, inform your member of parliament to ensure that this bill is passed. And once it's passed, then it is into a law, then we can enforce it. Then somebody was talking about passive smoking and relating it to TB. Actually, what we are talking about is not that it is transmission, that people, because people are sharing alcohol, cigarettes. I think that's what I should have picked from him. That's only tuberculosis that's transmitted through passive smoking. That's not correct. Actually, tuberculosis is not transmitted through passive smoking. It's only can be transmitted if you share a cigarette, or if somebody coughs in your presence and then the microbes are also coughed into the air, and then you inhale them, and then you get tuberculosis, and specifically looking at pulmonary or lung TB. So what we are saying, if somebody is smoking in your presence, you're also inhaling the air, and that air is the one that contains the nicotine that hurts your body, and therefore you get cancer. And therefore, if somebody smokes in your presence, please run away. And the enforcers of smoking, please, everybody is an enforcer within the anti-tobacco law. If you find somebody, if somebody smokes in the environment, you are at liberty to ask them to stop smoking, or to go to police and then let them get arrested. Each one of us is an enforcer in this law. That's the bit about the tobacco control law. It has given power. So don't allow somebody to smoke within your environment, even when it's your boss. There are some bosses who smoke from everywhere because they are bosses, and they puff those cigarettes before everybody because they are bosses. Some bosses are being driven in the car, and the driver is on driving seat. He's on the co-driver seat and is busy smoking. You're actually hurting the life of that driver. And as a driver, please, you have the right. It's within your right to ask him not to smoke, or you don't drive that car, or you drive him straight forward to the police, and he will be arrested and will be charged. Because the law talks about that, bans public smoking. There's a way to control public smoking. And then, of course, somebody was talking about shisha. Shisha is a banned product. If you find shisha, somebody smoking or doing shisha anywhere, please, it is within your right either to arrest them.
But they are everywhere in our bars.
Yeah, to call. So if you do not act when you see them, then you are the one who is actually siding with them. You are not accomplice into that. So it's within our means. Shisha is a banned product in our country. It's not supposed to be used. So so the other issue was of course somebody talked about he's taking a lot of honey, and what about it? The issue is that he's very conscious. He has also mentioned it with emphasis that's actually taking a lot. The moment you know that this is a lot, please, then it should be most likely it's going to hurt you. Because what we're looking at is the final product. If it is glucose, if it is sugar that's going to hurt your body, please come and stop taking whatever you're talking. Then the other person was talking about that the other countries that have banned, and I think I talked about Kavera. Then, of course, we are talking about
that we have failed to implement the Kavera ban in Uganda, yet it has been very effective in Rwanda, and yet they pick the bill from here to their country.
Yeah, we can ban the Kavera and the laws, because it's a matter of us talking to our members of parliament. We speak to the members of parliament. For us as UNCDA.
But they will say the parliament has done their best. They have passed that as a law. It is up to us now, the people of Uganda. And you, in advocacy, we thought that that's your fertile ground for you to
for us as advocates, one thing that we do is to advocate that there is a law in place.
Of course, don't mind about the implementation.
Hold them to hold the enforcers. And of course, that's what we are telling government, that please go and enforce. And if whoever has identified it, please enforce that.
What would you tell someone who says that you have failed to cooperate with the UNBS to make sure that the people of Uganda really consume what is of quality?
Actually, we have worked with UNBS on several things, including on tobacco control and regulations, setting standards. We have worked with them. If we have not gotten somewhere, then probably there is a problem with the UNBS, and of course their weakness sometimes there's lack of funding and inadequate resources to be able to reach what they are reaching. It's not that we haven't worked with them. We actually work with them severally, and we know their challenges, but we're also working into that.
Kasabi, I will give you much time later.
Comes in. There's somebody who talked about that they are urinating a lot, and probably
that is Annette.
And then another person also, I want to handle it to somebody who asked what could be the signs of diabetes. I think one, and that's something that people should know, that non-communicable diseases do not have signs or symptoms at the onset. By the time you start realizing them, probably you're very sick or they are complicated. So in any case, please make sure you go to the facility. So,
even when I'm feeling well, I should go.
Instead of checked, you never know. So please, whoever, and the lady who said that she's urinating a lot and probably taking a lot of water at night, run right now as we speak, go to this facility and have yourself checked for those NCDs that we mentioned. We may not prescribe for you here on radio, but the important thing is that get closer to the health facility and have yourself checked routinely. Thank you.
Call again on 776-511-426 that we may not leave your concern unattended or unanswered in this edition.
So Martin again.
You have seconds, sir.
Yeah, but I wanted to answer that man which is saying, I don't know if he's a doctor. Okay. Now he's saying that to arrest that person. Can you give us your number?
Which person?
The one has finished to talk about that if you find those people
taking shisha,
yes, that you arrest them. So I want you also to move every bar and you find those people. If they are not there, you call me.
I have arrested them.
You move around. Yes, lawyers also, they are the ones who are smoking. Met the doctors also, they are there seated. Yeah? So now, who is the who?
King and also accompanied by doctors. That's an interesting scenario then.
Have you seen that? So, whom are
Okay, thank you so very much, Martin, for that very concern. Indeed, that is a very brilliant observation. If the the lawyers accompanied by doctors are the ones who are smoking these things, then whom should we run to? All right, allow me bring in maybe before ABC.
Yes, Papa, 1 minute.
I thought would give the new callers a chance, but you have seconds, sir.
Okay, thank you. How about government to deal with the manufacturers? The label at the back of the cigarette cause cancer, and after death. But government, they are continuously gaining tax on the cigarette, tobacco, whatever it is.
Okay. Thank you. Indeed, UBC Ground Zero. We are live on 5 radio stations covering entire Uganda. Today we are talking about non-communicable diseases, and we say that it is very important that you go and check yourself. UBC Ground Zero. All right. Allow me bringing you Kansabe now. We had specific concerns to answer, and you must have heard from the people of Uganda, especially those that had those questions are really directed to you.
Thank you so much, Emon, and the listeners and my fellow panelists. So I'll start with a question about the nutrients that are lost during manufacturing of, during processing of food. Are they replaced? Now, there is what we call food fortification, whereby we add nutrients to food during processing. That is being done at the moment for some foods like oils and flours from maize. But that's not being done by everybody. And actually, the spirit behind fortification has always been to fight malnutrition. So the fortificants or the nutrients that we add have usually been those that are deficient in the population. So it has always mostly been zinc and vitamin A, and this has not necessarily been done in the spirit of replacing the nutrients that are lost during processing. So what we encourage industries to do is to do what we call minimal processing. So process to a certain extent and leave the food halfway between processed food and a natural food. Although, of course, that also presents some of its challenges because the food could easily go bad. So, but as government and as public health advocates, that is what we need, and we are tasking through the different policies, we are tasking industries, but also tasking ourselves to try and find out the innovative processing ways that can provide us with healthy foods and prevent us from consuming those ultra-processed foods that can actually cause NCDs. All right. Where can we report a neighbor who treats their cows and milks them immediately and sells the milk? Now, there is a new emerging field called the antimicrobial resistance. There's work that is ongoing on what they call antimicrobial resistance. Some of you might have gone to the hospitals and found that no drug in the hospital, especially the antibiotics, can treat you. And globally, that is becoming another crisis. There's no drug that exists anywhere in the world that can treat you at the time, because we have overused the drugs that we have, and our bodies the germs that we're trying to fight have grown resistant. They have learned to resist that disease. So there is work that is ongoing globally, especially in developing regulatory frameworks, and until these regulatory frameworks are also adopted by Uganda, and then we are able to enforce and even know where to report these people. In the meantime, we can engage, through civil means, talk to this person and tell them that...
Before we report them and imprison them, one needs to know, after vaccinating a cow, how long do I take to milk it?
Usually, thank you so much. Usually, these instructions are even provided by the people where you buy that drug from. The veterinary shops that sell these drugs. If they have not provided you that information, please ask. If that information, if the person does not know, sometimes that information is written on the drug pack. So try to read, and like the rest of the members said,
those who sell those vaccines, as you've put, because some of these cattle keepers, most of them, I would say, that they are not educated to be able to read those prescriptions that are on the packing. So you'd find that perhaps we need to empower those who sell those vaccines to be able to tell those they sell these products. Okay. But also someone also had a concern, Kansabe, that we are feeding on everything that has been sprayed. If you are planting tomatoes, onions, or any plant today, one you'd think about is buying or saving money for some pesticides. Are we not at risk of these NCDs because what we feed, almost 99 have been sprayed in the garden and also in the stores?
Yes. Thank you so much, Emon, and the person who has raised that question. At the moment, our problem is not that you are spraying. Well, partly it is our problem because some of the residues of the whatever you're spraying gets into the soil, and the crops take it up, and eventually we get it from the crops. But what we are mostly advocating for at the moment is, do not harvest your crops within a certain period of time that you've been told not to harvest after spraying, because you get a very big exposure to these pesticides because they are still active in the plant. So after some days, what happens is that the plant itself breaks down these chemicals and they become harmless. So if you pick the plant before the chemicals have been broken down, you're going to eat them live. So it's like you've sprayed yourself. You're spraying yourself. So we need to be able to make sure that we keep tabs, especially farmers. We need to have, I think some people call it Ubuntu, to think about ourselves, to think about the person who is going to eat the food that you're producing. That person could be your child whom you sent in school in Kampala. You are here spraying the foods and you're being irresponsible with your spraying, but the food could end up on your child's plate in a Kampala school.
I'm afraid time is not on our side. May request you gentlemen and lady to give us your parting shots as we end our conversation today, and I will start with you, Kansabe.
Thank you so much, Emon, and the listeners. I would just want to drum it into our listeners' ears that it all starts with us. We have to take responsibility. NCDs are not just what we've told you. It is many things. You're not only eating unhealthy food, but you're also passing through air which is polluted. By the way, for your information, 99% of the world's population is living in areas that are highly polluted with air. In other words, 99% of the world is uninhabitable according to the World Health Organization. So you are constantly under exposure to polluted air. You're eating unhealthy foods. You are, if you've maybe decided not to drink alcohol, but you're also not physically active. 54% of Ugandans are not physically active.
All right.
So we need to be able to reduce the factors, work on the factors that that are within our control, because many other factors are not within our control.
Thank you. Kwizela?
Thank you so much, Emon. I think before I conclude, I think I just wanted to make a follow-up on the questions on the response on the sprays and somebody who is milking the cow immediately after vaccinating or injecting it with some chemicals. I think that's a wrong thing. But what we need to invite people to do is please liaise with the vets, the veterinary officers. I'm sure every community has a veterinary officer, every community has an agriculture extension officer who's supposed to be in charge and who's supposed to be able to educate the population. And to me, that's the best I can do. This country has a lot of resources, and like we said, non-communicable diseases are not only a health issue. When you look at the risk factors are manufactured by other partners or other parties, and then the burden comes to the health sector. So the industry, the finance, and the trade, the schools, the agriculture, all those manufacture these issues, but then they end up in the hands of the Ministry of Health to be able to solve. So we want to call upon everybody and everyone, just like Shari has said, that begins with us. You're talking about doctors accompanying lawyers who are smoking. When you go to non-communicable diseases, even the doctors are not spared, because these NCDs affect everybody. The doctor you are running to could also be running to another doctor, treat them with the cancer. And the one who's treating the cancer probably is getting treatment from somebody who's treating him of high blood pressure. And somebody else who could also be having a mother, a grandmother, or an aunt or an uncle who is somewhere taking drugs, or who needs services of diabetes. So the problem is actually shared by all, and we all must rise up, including the doctors. So whenever we are talking to people, we're not talking to everybody. We're even talking to ourselves within the studio. Even the workers here at UBC, please make sure that they also know about these issues. It's not outside. It just starts from where we are seated here, and as we speak to people, we're also speaking to ourselves. So fighting non-communicable diseases begins with you, and don't look out to any other person. If it is smoking, please make sure you control. You may not smoke, but somebody smokes within your environment. You may not be drinking alcohol, but you're on the road. The drunken driver will come and crash into your car, or the drunken driver will knock you on that border that you sit on. Don't allow the border to drive when he's just busy putting that cover of liquor into his mouth. It is we who is going to die. So please become the first enforcer in managing or preventing non-communicable diseases. I want to thank you.
Much welcome to and many thanks, Dr. Kwizel, Dr. Komakech, submit all as we end our conversation.
Thank you, moderator. I want to, in the spirit of awareness creation, I want to add on to my colleagues. They have already mentioned stop tobacco use, be physically active, use alcohol responsibly. We encourage you to consume healthy diets, avoid air pollution, and finally, but not the least, do regular medical checkup. Thank you.
Most welcome, Dr. Dennis Komakech and Kwizela, coming from Uganda Uganda Non-Communicable Diseases Alliance, and it was also a privilege having you, Shari, coming from Chambogo University, that made it a point to come through and educate the people of Uganda on this edition of UBC Ground Zero. We cannot really take that for granted, and we thank you so very much that you are able to come through and be able to help us understand, but also appreciate what we need to do to make sure that we keep healthy. So as we end, we wrap up today's discussion on non-communicable diseases. I would extend my heartfelt thank you to you, our dear listeners from the other side of radio, who have been part of us from the time we started our conversation or this program until this time that we have to end it. I believe that you've picked one word or the other that will help you live a longer and healthy life. And we must thank you for the time you have been with us. To those that sent in your messages and those that called in this program, I believe that we have answered all your concerns and questions. Until next time, same station, same program. Many programs are coming your way on UBC Radio, on UBC Butebo, on UBC West Nile, on Magic 100 FM, and Voice of Butebo. UBC Ground Zero repeat is always on Saturday from 3 p.m. to 5 p.m. on UBC Radio in Kampala, and also on Voice of Butebo on Monday. Keep UBC. We shall keep inspiring you, the people of Uganda. Thank you, our dear guests, and for making time for today's edition. God bless you.
That was Ground Zero Season 2, a production of Uganda Broadcasting Corporation, UBC, inspiring Uganda.
At UBC Radio, all our radio network across the country is committed to inform, entertain, educate, and guide for national transformation.
Our own radio, UBC, should set its own example. Leka bano abatafa ku bantu baffe bagumaza ndowooza muganda kito kugumaza to divert people. Let our own UBC bring programs to educate the people so that abagala kugumaza babeereyo bagumaza naye naffe they can advise, guide. And people in time will judge the one who is their friend and who is just using them.
Tune into UBC Radios for credible socio-economic programs. UBC, inspiring Uganda. Don't miss UBC Radio Ground Zero every Saturday from 10 a.m. to 12 p.m. We host credible and relevant guests to discuss pertinent issues of national importance aimed at addressing people's concerns.
As a country, if we don't fight this vice of corruption seriously and with honest opinion without any bias, things will not be good for us.
UBC Radio Ground Zero, right here on UBC Radio.
UBC, ensure that the information you give out is factual but also objective, balanced, and complies with the legal and policy requirements for the media.
Ground Zero program is always live, loud and clear, every Saturday from 10 a.m. to 12 p.m. on UBC Radio, Butebo FM, West Nile FM, and Magic 100 FM, and live stream on YouTube. You can also listen to the repeated broadcast of UBC Ground Zero every Sunday from 3 p.m. to 5 p.m. UBC Radio, inspiring Uganda.
A family is a group of one or more parents and their children living together as a unit. Sometimes this unit extends beyond the nuclear family to include relatives and grandparents. Every Tuesday night at 10:15 p.m., UBC Radio brings you The Family, a radio show that navigates through family affairs for peace, harmony, and unity. Here on UBC Radio, inspiring Uganda.
This is UBC Radio. Tune in for news.
At UBC Radio, we bring you Uganda's latest news and information.
Focus on Parliament.
What we need to do, the Prime Minister must give us the position before we finalize with the budgeting process.
Enjoy sports. The environment. Politics.
The mission we have is socio-economic transformation.
Health, entertainment, updates in education, on the farm. Keep tuned into UBC Radio, inspiring Uganda.
Are you a Uganda?
Ugandan earning below 1 million shillings per year? Government of Uganda is strategically putting PDM for you to get you out of poverty. PDM is an initiative of the Government of Uganda through the Ministry of Local Government designed to transform the lives of all Ugandans for better.
Get to know more about PDM in your parish by tuning in. We bring you experts to explain, clarify, educate, and interact with you on how to benefit from PDM.
PDM,